Hello, everyone. I'm Gere, the Medical Director of FzioMed in California in the United States, talking to you today about adhesions that form after hysteroscopic surgery. We all know about adhesions. We've had experience with them in all of our procedures. They're fibrous bands which form as a natural part of the body's healing in response to different kinds of trauma. I've grouped this into surgical trauma, as you can see, happening very quickly, and then more insidious traumas that lead to adhesion formation, including inflammation and endometriosis. What kind of problems do adhesions cause? Well, they cause a number of problems. We can group them into pain-related issues, common to all the surgical procedures that we're involved with. But as gynecologic surgeons, we also have infertility and all too often small bowel obstruction from intraperitoneal surgery. And from hysteroscopic surgery, we have the additional complication of abnormal uterine bleeding from adhesions. The adhesions occur very commonly after hysteroscopic surgery, which may come as a surprise to most of you. As you can see, the procedures involving removal of myomas or polyps, especially adhesiolysis, removal of products of conception. Adhesions occur sometimes in the majority of cases in series. Adhesions are found in 20% of women after spontaneous abortions. In terms of infertility, the adhesions oftentimes inhibit the ability of the embryo to enter the endometrial cavity and prevent implantation. Abnormal uterine bleeding, dysmenorrhea, pregnancy loss, special problems with intrauterine adhesions. And of course, from the standpoint of view of the surgeon, intrauterine adhesions inhibit visualization, which can lead to surgical complications, including uterine perforation. So we're all looking for a way to reduce intrauterine adhesions after our hysteroscopic procedures. The FzioMed company in California, the leader in adhesion prevention technology, has recently developed and now made available Oxyplex intrauterine adhesion prevention device. It's an interesting device. It's composed of two different biomaterials. One's a polysaccharide and the other is ethylene oxide. They're mixed together with some ions to produce a unique formulation that contains no animal products or proteins, so it's entirely biocompatible and bioresorbable, and as we'll discuss in a moment, very easy to use. The Oxyplex IU product is part of the ever-expanding platform of FzioMed adhesion prevention devices, as you can see here. FzioMed provides adhesion prevention products around the world in spine surgery, gynecologic, general surgery, tendon and peripheral nerve surgery. And now, after over 70,000 units distributed for these types of surgeries, we now have a product available for intrauterine adhesion prevention. Well, how does Oxyplex IU work? Well, the CMC and the PEO are very much involved with coating the surface of the endometrial cavity. The PEO limits the interaction of the fibrin proteins, and the fibrin proteins therefore cannot form fibrin bridges. And the CMC increases the residence time of the PEO, so the product is designed to be there to coat the endometrial cavity and separate the healing tissues, providing a temporary barrier to adhesion formation. Oxyplex IU clears by passage through the cervical os without requiring a second operation for removal. In premenopausal women, the gel will not remain after menstruation, and women who do not menstruation, it's been shown that the gel clears within 30 days in a variety of clinical and preclinical studies. Well, what is the product as it's available to you? It's composed of the box is composed of a sterile syringe, as you can see on the left, and an intrauterine applicator. We'll have more to say about that in a moment. It's a mechanical barrier, so it does not have any pharmaceutical or drug activity. It simply limits the exposure of the damaged surfaces from one to another. The product works very nicely in terms of reducing the extent, the incidence, and the severity of adhesions, and we'll talk about some of that clinical data in just a moment. It comes ready to use. So the syringe comes right out of the box. It doesn't require any mixing or heating. It's stored at room temperature without any degradation. And as I said, there are no animal or bacterial components, so it adheres very well to tissue. Now, what about the applicator? The applicator is specially designed for intrauterine use. It's a semi-rigid design, so you can use actually to enter the cavity and manipulate somewhat for visualization. It's a 15-centimeter tube, so there's plenty of length to it. It consists of an inner diameter to ensure ease of application and absolutely no chance of damage to the tissues while the material is being delivered under direct visualization. This is a video that shows the application of the material. You can see the resected tissue. The applicator tip goes inside. The gel then is slowly applied under direct visualization. As the tip is moved to the top of the uterus, the gel fills the entire endometrial cavity, and as a result, there's complete separation, allowing the tissues to heal underneath it. Well, how well does it work? Well, there are a number of clinical trials. I want to summarize some of them for you. This is a study from the group in Naples, Despiccio Sardo. They did a hysteroscopic surgery in over 100 women and followed them up 1 month later to assess the presence or absence of adhesions. There was a control group, and as you can see, the adhesions formed the control group more than 3 times than they did in the treatment group. And in addition, the subjects that were treated with the gel also increased the incidence of tubal opening or visualization of the ostia in the endometrial cavity. The bottom graph is from the publication. It gives you the different types of surgeries: myomectomies, polypectomies, metroplasties, endometrial ablation. The first group, the incidence of adhesions after Oxyplex, and the far right group, the control, and you can see there's a 3 times difference. Works in all kinds of hysteroscopic surgical procedures. In terms of the clinical results from a group in Israel, Fuchs evaluated Oxiplex IU use after removal of retained products of conception. As you can see in the results, the subjects that were treated with the IU gel were less likely to develop moderate to severe adhesions compared to controls. Again, it's a 3 times increase in adhesions with the controls versus the Oxiplex. And importantly, subjects that were treated with the Oxiplex IU had improved pregnancy rates compared to controls. And this number was, as you can see at the bottom, statistically significant. In terms of a follow-up study with the Despiccio in hysteroscopic metroplasty, a very difficult procedure that a lot of us are now performing, especially in women who either cannot conceive or have repeated pregnancy loss. He performed the study in 30 individuals, followed them up at 15 months, and found that the clinical pregnancy rate was 57%. And recall with me now, all these women were infertile, so over half of them then got pregnant after the metroplasty, and 2/3 of them successfully carried their pregnancies to term. Another report and very nice case study from Australia. This was a 34-year-old woman with a history of repeat pregnancy loss with abnormal uterine bleeding. Her miscarriages were in the first trimester. She underwent diagnostic ultrasound with the follow-up hysteroscopy and was found to have a septate uterus. She wanted to go ahead and try and conceive again, even with that diagnosis. She again got pregnant in 3 months. 17 weeks later, once again, she had pregnancy loss. So she underwent removal of the septum hysteroscopically, followed by installation of 10 milliliters of Oxiplex IU. There are no issues in terms of the surgical procedure or post-op complications. For the first couple months after the procedure, she had normal periods, no dysmenorrhea. She conceived spontaneously, and I'm happy to report that she's now a little bit beyond 24 weeks of gestation, is doing well, and we expect a full-term pregnancy. So in summary then, why use an adhesion prevention barrier Well, as we know, the majority of cases, particularly after myomectomies and metroplasties, Ds and Cs, women do develop adhesions, which are often associated with infertility, recurrent miscarriages, and dysmenorrhea. And from our point of view as surgeons, decreased visualization of the endometrial cavity and can cause complications such as uterine perforation. The Oxyplex material itself, it's ideal. It's designed for this use. It's entirely synthetic, can be stored at room temperature, ready to use. A syringe comes right out of the box, can be applied to the rounded edge applicator that's also in the box, found to adhere well to tissue, is absorbable, excellent clinical results, and it's another contribution of the FzioMed to an ever-growing family of products for adhesion prevention. Thank you very much.
Thank you, Dr. diZerega, for that wonderful presentation. For the audience, please submit any questions regarding the presentation through Zoom, and we will do our best to respond promptly. Please visit the virtual FzioMed booth during the Congress to learn more about our products or to contact someone at FzioMed directly. Thank you for your time and attention.